Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding your claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type that in the chat. At the bottom of your screen, you will see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Juli Cowden. Juli is the coordinator of volunteers for the Medicare Assistance Program at the Oklahoma Insurance Department and has been in that role for a little over a year. She has worked in public health and around the medical field for 15 years. Helping beneficiaries navigate Medicare and learn how it works for them makes her position very rewarding. Juli, over to you.
Great. Thank you so much, Rachel. I'm so glad to be here today. Are you seeing my screen okay?
Yep, everything looks great, Juli.
All right, wonderful. So first, a little bit about our program here in Oklahoma. The Medicare Assistance Program exists through grants administered by the Administration for Community Living, and these grants allow our program to provide objective education and assistance to Medicare beneficiaries, caregivers, family members, and others. One grant is the State Health Insurance Assistance Program, or SHIP, which covers the basics of Medicare and options that are available to beneficiaries. Another grant is the Senior Medicare Patrol, or SMP, and this grant allows us to assist beneficiaries with understanding their statements and claims and to avoid becoming victims of fraud. We do have a third grant. It's the Medicare Improvements for Patients and Providers Act, or MIPA. And the purpose of this grant is to identify lower income beneficiaries who may need assistance with prescriptions or Part B premiums, and then get them connected to those resources. We also partner with agencies around the state using trained counselors to provide services for all Oklahoma Medicare beneficiaries. Today, we are going to be talking about Medicare coverage and how it relates to mental health. Mental health has been in the news more and more lately, so we thought it would be beneficial for Medicare beneficiaries to understand how mental health fits into Medicare coverage. First, let's talk about the aging population in America. So the baby boomer generation, those born from 1946 to 1964, by 2030, all of those folks are going to be older than age 65. So that's 20% of the population. And based on the 2020 census, it's projected there will be more residents in 2030 that are over 65 than age 18 and younger. And now looking at life expectancy, males can expect to be on Medicare for about 8 years, females for about 14 years, although we all know folks who live much longer. Now, how do mental health and aging correlate? We know depression is more common in people with other illnesses. Having heart disease, diabetes, even suffering a stroke can increase the risk of depression. And depression is often misdiagnosed and undertreated. It can be misdiagnosed as anemia, B12 deficiency, or even hypothyroidism, since the symptoms are very similar. And some providers even have trouble recognizing and differentiating between those symptoms being depression or another illness. Older folks who are hospitalized or need home health care do have a higher incidence of depression. And few older adults receive the treatment they need when they have a mental health and or substance disorder. And these disorders often coexist. Oftentimes, folks may try to self-medicate because they have a mental health issue, and that then evolves into a substance use disorder. And mental health contributes greatly to the incidence of suicide. And lack of access to adequate, affordable care can increase stress, which in turn can lead directly to mental health issues. Factors that influence mental health: loss and loneliness. About a third of seniors live alone, and a lack of interaction with others can increase stress. Loneliness is also associated with an increased risk of depression and anxiety. The loss of many meaningful relationships, be that through retirement from your job, the inability to leave home very easily, or other reasons, can also lead to feelings of loneliness and depression. Poverty, this is the big one. Economic insecurity disproportionately affects older Americans, especially women and minorities. The Kaiser Family Foundation has found that over half of Black and Hispanic persons over age 65 live below 200% of the poverty level. And that is where that MIPA grant can really help, when we can identify those folks and get them connected to resources. Disabilities. Over a third of older adults report some type of disability, and most often those are associated with getting older. Cognition, self-care, hearing, vision, ability to move around even within your own home. Those disabilities come with age. Now, for beneficiaries who are younger than 65, there are factors such as a lack of mobility or a lack of accessibility. It's difficult to shop. They have trouble sometimes accessing needed services or even getting transportation. And then you have social barriers and isolation, and even something viewed as simple, such as getting a job, that can sometimes be a real problem for a younger beneficiary with a disability. And in fact, mental illness is experienced more by those who are under 65 or low income. The outcomes of poor mental health, these are known by many. There've been a lot of studies on these. But the incidence of poor outcomes and mortality, heart disease, cancer, hip fractures, diabetes. A little earlier, we mentioned some of these. And when folks have those diseases, they sometimes and often suffer poorer outcomes due to the mental health and stress that's put on them by those conditions. And this in turn increases Medicare spending. In fact, it is 2 to 3 times higher for beneficiaries that do have a mental illness, and that accounts for 12.7% of total Medicare spending. Now, to the good news. How Medicare helps. Part B services. They offer an annual depression screening. That means each year a Medicare beneficiary can receive a depression screening in a primary care office or clinic that can also provide follow-up treatment and referrals. And there's no cost for that screening if the provider accepts Medicare assignment, which means they accept Medicare's negotiated rate as payment in full. And since we are talking about Part B services, of course, all of these are outpatient mental health services, which means it's in a doctor's office, in a hospital outpatient department, or community mental health center. Even rural access hospitals now can bill for these services. Individual and group psychotherapy and psychiatric evaluation, and of course, medication management, because that is very important in controlling mental illness. Some other Part B services that are offered can include the opioid use disorder treatment and alcohol misuse screening and counseling, and that is done in the primary care office. And then behavioral health integration services, which occurs in a primary care setting and is shown to improve outcomes and reduce cultural barriers and stigmas associated with mental health. And this is new in 2024 that they are allowing and working on these behavioral health integration services. So you can get your care in one place, whether it be for mental health or for overall physical health. And then tobacco use prevention and cessation counseling. And the reason I've included these Part B services are because those with substance abuse disorders are more than twice as likely to have mental health issues. So partial hospitalization. This is a new one for 2024 as well. It covers intensive outpatient program services, which are administered as an alternative to inpatient psychiatric care. Now, what do the costs look like with these Part B services? The deductible of $240 for this year, 2024. That amount does change each year, but once you've met that, these Part B services are going to be 20% that you're responsible for. And if you are in the hospital ever, you may have some additional copays. Now let's look at Part A. What does it cover? Well, it's going to cover your inpatient care. And much like for services that are not related to mental health, your inpatient services, it's going to include your semi-private room and meals. They're not going to let you go hungry. General nursing and medications, and then other hospital services and supplies. Now, that is in a general hospital. If you are inpatient in a freestanding psychiatric hospital, you are limited to 190 days total across your lifetime. And the Part A costs. There's a $1,632 deductible per benefit period, and you can have multiple benefit periods per year. Anytime you go more than 60 days without a Part A benefit being paid, you will enter a new benefit period. After that, you can see the cost for subsequent days. And unlike the freestanding psychiatric hospital, which does have a limit on lifetime days, you can see each benefit period, you will start a period where Medicare is going to cover your cost. Now, medication. All Part D drug plans for Medicare are required to cover certain classes of medication. And that does cover the medications you see here and a wide range of other psychotropic meds, anti-anxiety drugs. They do have to cover those certain classes. Telehealth. You have to have an in-person visit within the 6 months prior to your first telehealth visit, and then once a year thereafter. Now, for 2024, that 6-month rule has been waived, and that's somewhat of a tail onto the public health emergency that we had due to COVID. And another thing about telehealth visits and behavioral health, mental health, is that those telehealth visits can be audio only, but only if they are related to behavioral health, mental health. And then new this year for counseling, now licensed counselors can accept Medicare. In the past, any counseling had to be provided by a psychiatrist, a regular doctor, physician's assistant, nurse practitioner. Now, marriage and family therapists and other licensed professional counselors can choose to accept Medicare. So that is great as far as the counseling goes. And then those other providers are still very much active and very much accepting of Medicare, and you can see them as well. Now for resources, the National Council on Aging, NCOA or NCOA, you may hear it referred to, has a wealth of information on not only mental health and addiction services, but other facets of Medicare. I encourage you to go check them out if you have questions. Medicare.gov is a great resource. You can search mental health and see how Medicare is going to cover services related to mental health. You can also find things such as the current handbook and other information on providers. If you're looking for a counselor, you can go on to Medicare.gov and search and find which counselors in your area are available and accepting Medicare. And of course, if you do have an Advantage plan, make sure that provider is in network and that your Advantage plan will work with them. 988, the Mental Health Emergency Hotline, and 1-800-950-NAMI. Those are both resources for folks who have mental health issues or crises. Of course, if someone is in immediate crisis, they need to call 911. But if you have family members, friends, others that you know who may be struggling a little with some depression or anxiety or other mental health issues, please encourage them to call one of those two lines or to text helpline to 62640. Our partner agencies around the state we mentioned earlier. Here you see a list of those agencies and the counties for which they are responsible. Each of these agencies has at least one trained Medicare counselor at their facility who is able to help you navigate through Medicare and let you know what your options are. Coming attractions. Next month, you see Medicare fraud prevention, and then you can see through the end of the year, we'll wrap it up in December with the changes for 2025. Don't miss that one. There are some great things coming. And also, we do have a senior fraud prevention conference. You see the 4 dates listed. We're still ironing out details, but get those dates on your calendar because you won't want to miss those. They're great. Okay, Rachel, do we happen to have any questions in the chat?
Thanks, Julie. We do not have any questions yet. Just a reminder, everyone, that you can click on that chat icon and you can type your questions if you have any. If you've got a question that maybe you think of after we get off of this webinar today, you can always email it to us at map@oid.ok.gov. I'm going to give everyone a second in case they are asking a question. Let's wait just a moment here. And just a friendly reminder, everybody, if you do want to see any of our webinars that we've done this year or the ones that are coming up, those are all available on demand. You can go to that website listed below on your screen, that map.oid.ok.gov, and click on that educational videos tab, and you can see all of our resources there. All right, so Julie, it looks like we don't have any questions.
Okay.
Well, thank you all so much for your time today, and I hope everyone has a great rest of their day.
Thank you, Rachel.
Okay, bye-bye, guys.